Hello, everyone. This is session 2 of the Educational Outreach Program that is a collaboration between GrenCHAP, the Grenada Planned Parenthood Association, the Ministry of Health Grenada, with funding from the Canada Fund for Local Initiatives. Now, through this collaborative efforts, the goal is to address the lack of access to comprehensive, integrated, client-centered, including youth-friendly sexual reproductive health and rights, and HIV and gender-based violence in Grenada. I am your host, Lorna Dale Charles, and my guest today is my colleague and my friend, Ms. Kizzy Ann M Abraham, and we're discussing the topic barriers of effective healthcare. Kizzy, welcome to the program, and tell the audience about yourself and your role that you play with GrenCHAP.
So good night, everyone. And Lauderdale, thank you. Thank you to the Social Mind for having us on again as part of our awareness campaign and drive to promote greater access to SRH services. My role with GrenCHAP currently, I am a board member, but I've been a volunteer with the organization for a number of years now. As a board member, you can say that I play somewhat of a key role in our program design. And today I'm here to talk on a partnership that we have going with the Grenada Planned Parenthood, and specifically speaking today about the barriers that, our men and boys face accessing SRH, members of our disabled communities and other vulnerable persons, for example, people living with HIV and persons who are often stigmatized in our society because of lifestyle choices.
Yeah, and sometimes a socioeconomic status. Yeah, so
yes, cannot leave
again.
Out.
I know again. So I guess my first question to you would be, you talk about men and boys. What are some of the barriers that men and boys are facing in accessing healthcare services in Grenada?
Okay, so obviously I'm not a man or a boy, so it's like, okay, why, what's the connection there? But I just want to highlight, just from working previously to being a volunteer with GrenCHAP and working where I work now, I actually worked at the Planned Parenthood Association for a number of years. And from my personal observation, when you looked at who came to the clinic to access services, it was predominantly women. So I think that was the first thing that, started like making me curious about, why aren't more men and boys coming to access services? They do have reproductive organs as well. Reproductive health is not a woman's issue solely. But in terms of, trying to come up with answers, some of the issues are systematic, as well as a lot of the reasons why, men and boys do not access services has a lot to do with their ideas of masculinity and their view of health-seeking behavior. And that raises the question of, how adequately are our health systems designed to address these two particular challenges? So not just only with primary healthcare, you see barriers to men's access, but also when it comes to mental health. And there are lots of studies that actually show that, one of the strongest factors that hinder men from accessing mental health services is their ideas of masculinity, as I mentioned before, and how health-seeking behavior factors into that definition, as well as, men and boys are socialized to view themselves as strong. So the threshold for pain and, avoiding certain symptoms, I imagine is much higher for them in comparison to us women and girls.
Absolutely. And there's another group that you mentioned in your introduction, that of the disabled. What barriers would you say those persons who are physically challenged, and sometimes you may not be able to see that disability, but somebody's experiencing function with a disability. So what are the barriers do persons with disability face accessing, again, our healthcare systems in Grenada?
Well, I think oftentimes when we think of disability, we automatically think of persons who may be physically
Physically
challenged,
challenged, right?
you know, and so there are levels to their access that parallels with the category of their disability, if I can put it that way. But in terms of physical access, I mean, we do not live in an environment where that was a priority when, facilities were being constructed. But I'm glad to say that in the age of sustainable development, you hear a lot more dialogue now on constructing facilities that have disability access. But saying all of that to say that not every healthcare center on the island has disability access. There are a few. So, for example, you can find the center in Guelph, the one in Sates, Hermitage, Hillsborough, Carriacou, and Grand Roy. These have access ramps. So if you are physically challenged, there's access at these facilities for you. So I think it's important to have this sort of information accessible so persons know living in proximity to these centers that they can go there and get there comfortably. In terms of other challenges, if you have a disability where communication is a challenge and your healthcare provider has not been trained or has not been adequately sensitized on, how to share information with you as well as to get information from you, that can create a challenge. It can be a barrier. There's also access to medical equipment. I mean, even us able-bodied people are sometimes challenged by the fact that the adequate equipment is not available to diagnose or treat. So you can just imagine how that is multiplied for persons who are living with disability, especially if it's something that's neurological, Yes.
Okay. So let me see how I would think about that. So persons who are vulnerable, because we have different categories of persons in the society who can't access healthcare effectively because I think I mentioned at the beginning, sometimes their social economic status, and that puts them in a vulnerable position. So for the vulnerable persons, again, how does that group access healthcare services in Grenada? From your experience, I suppose, working with GrenCHAP and working with the Grenada Planned Parenthood and all the other services, social institutions that you have worked with, I'm sure you've seen that is playing out across mostly all of those institutions, right?
Yes. And vulnerability is layered. There are levels to it. I mean, there's vulnerability in terms of your sexual orientation, vulnerability in terms of your economic status, employment, all of these things, even academic, So to speak in a general way that would encompass all vulnerable groups, I think it is important for health advocates to sensitize health professionals on how they engage with vulnerable members of their communities. So, for example, for someone who may be economically disadvantaged, what we have found at GrenCHAP is that it's important in cases like that when we are not only just creating opportunities for them to access, but we also have to consider, do they have the capacity to take a bus to come to our office to access HIV testing services? Because it's one thing to say, we started providing this service now and no one's coming. Sometimes that is heavily tied to the vulnerability of there's just no bus allowance to do so, In other cases where persons may be academically challenged, I think as a healthcare professional, it's important to be mindful of this. so that you may have to do more probing. I'm not a health professional, so I'm not going to speak on it as
understand.
though I
Speak
have
up.
full
Yeah.
authority.
Right.
But just from my
Yeah.
experience,
Experiences. Yeah.
from my
It's
experiences, I
valid.
think it's very important to reach the client at a level where they are. So sometimes this might not be a person who would be forthcoming with information on why they're there.
Right.
So I think it really warrants a lot of mindfulness and observation, and especially, clients are required to fill out registration forms. So, adequately reviewing it and asking follow-up questions in a way that is not condescending. Like, so for example, a client comes in and she's never had a pap smear done. It's not something to be alarmed by. There could be many, many reasons why. Economic as well. It's very, very expensive to access these services at private centers, and even
Absolutely.
in the public service through the health centers. The fixed times can limit a lot of people. Imagine if you're a domestic worker. This is a very laborious job. You're oftentimes not going to be able to take time off to go take care of a doctor's appointment or something like that, because between doing your job, you have to also, probably attend to your dependents, whether that's, siblings, children, elderly
Yeah.
parents,
Right.
so many, many, many layers to it. But I think it's organizations like GrenCHAP, like GPPA, who are really, really pushing themselves to reach vulnerable communities, that I think is really bridging the gap.
It's really important. You're absolutely right. And one of the things that you mentioned, someone might come into, let's say, the Grenada Planned Parenthood Association, and they may be coming in for that perhaps maybe for the first time, and you, as I suppose the medical practitioner, might be alarmed, and sometimes one can be pushed to say the wrong thing, not being sensitive. But as you mentioned, there might be a lot of layers to that. Sometimes it's the first time they heard about the pap smear and they're actually going to do it. Because they might be talking to someone in the community. They might have seen something. Social media is popular now. They might see something on the radio, the television, or Facebook for that matter, and they can go. And it's like, okay, do their research because they are concerned about their health. So most of the times it's a lack of knowledge, that they don't know that it's supposed to start it at this particular time and how often you're supposed to be doing it. So you're absolutely correct in saying there's a lot of layers that sometimes goes with, and one of it is a lack of knowledge, and people just don't know what they don't know until that information is made available to them. So I'm happy that GrenCHAP, through this initiative with the Ministry of Health and the Grenada Planned Parenthood, is putting that information out there. Another thing is, you might say that the information is out there and people don't get it. You have to go where the people are, and people are now on social media. So I think this current initiative of doing it on social media, people can access it at any time. So as opposed to having it in the community, and like you said, they might be at work, they're coming from work, they have siblings to attend to, they may not have the time to go to the community center to come to that meeting to find out what is happening in the community center about health, about some of those health benefits, or the health challenges that they might be facing. So probably when they're home and they're more relaxed, they can jump on their computer or on their smartphones and really access this. So I think this is really enlightening and powerful at GrenCHAP, and the collaboration that you're making with the Ministry of Education and the Grenada Planned Parenthood is really, really, really good. So one of the other questions that I want to ask you: how do these barriers negatively affect the reproductive health of those persons living in let's say vulnerable or hidden communities? I mean, just for all the vulnerable groups that we are mentioning here, how does those barriers, what are those barriers, and how those barriers affect their health negatively, their reproductive health negatively?
So I'll start off with men and boys. Definitely what you see on the ground, especially in the field of SRH, is that men and boys are oftentimes not being diagnosed in the early stages of infection. And I'm speaking specifically to STI infection.
Okay.
You know, one of the factors that research shows that accounts for why so many men more than women are infected with HIV is also attributed to the fact that not accessing reproductive commodities like condoms, because you know SRH is just associated with it being women's issue, a women's issue. So the barrier affects in the sense that waiting too late to be treated. I mean, some STIs are curable, you know, and there are also some that if you leave them untreated for too long, it leads to other severe health problems, for example, infertility.
Right.
So the barriers to their access provokes that. Barriers to their access also hinders their rehabilitation. For example, if we're thinking in terms of mental health, you know, depression and how long men and boys stay in states of mental unrest and emotional unrest because services are not designed to cater to them. For example, alone with the operating hours, which is one really huge advantage of this public-private partnership, that it has allowed the health facilities to extend their operating hours up until 6 p.m. When we think about the industries where our men and, you know, young boys work, we're talking about service industries, largely dominating in our service sector. So construction, you know, all our industries that require trade work and these areas. And when you think about the working hours of these fields, it's way outside the regular operating hours for health facilities, just to, you know, associated to that barrier. In terms of other vulnerable groups, again, you know, not getting things treated in a time period that would allow you to not have to spend a great deal on it, not have to take a lot of time off for recovery, you know, not having to make too many lifestyle changes that would, you know, create an imbalance in how much funds you have to maybe take care of your family, you know, pursue other personal development things. You know, it affects these things greatly. And I mean, not to sound too extreme, but in some cases, you know, we know if certain health issues are left untreated, left unchecked, it can result in death. Absolutely. You know, and if you have your main breadwinners in the household dying because of untreated SRH related matters, it just, you see how that ripple effect really can exacerbate.
Right, it can impact,
you know, homes, communities, negatively.
Absolutely.
Yeah.
Absolutely. That of hidden, I suppose, hidden communities, and I'm talking about where there is probably one health center that might be in a remote area, and some persons just don't have, like you say, the funding to probably take a simple as a bus to get from point A to point B. Would you say that you've seen that happening in your line of work with GrenCHAP and the Grenada Planned Parenthood?
What we have observed at GrenCHAP is that training persons, particularly to the sensitivities of our key populations, and creating access in safe spaces where our communities feel comfortable coming, and where we are able to provide psychosocial support, where we're able to provide a stipend to accommodate travel. We have seen an uptake, you know, so we have correlated it to us taking these measures to bridge the gap.
Absolutely. And I know one of the things you mentioned in terms of our men, they are most times the breadwinner. So I suppose sometimes it's not of even if you set up an appointment for them, they might think about the dollar as opposed to them health, because they're so focused on providing for their families. And if they miss a day work, then it's gonna cause, like you say, that ripple effect. Something is gonna be lacking somewhere along the way. So I know that is one of the key reasons. And then we also have that of our society that is very cultural, where if a man expresses pain, for example, or if he cries, we sort of make, I guess, diminish his masculinity. So sometimes men kind of stuck it up and go to work, and they might be in pain, might be uncomfortable. And it doesn't even have to be, sometimes, I know we're talking about our sexual reproductive health, but it might be something a little bit minor, but it just might need checking a doctor, right? And, we have this traditional way of this bush medicine. Sometimes it doesn't work. And I want to encourage persons, both sexes, to, do your yearly checkups. Go to the different clinics, the different health centers, do your yearly checkup. And I really love this initiatives by GrenCHAP, that you actually going into the communities, which we'll talk about. I guess that would be our next line of conversation, that you actually go into the communities and provide the different services. So how organizations like the Grenada Planned Parenthood Association and GrenCHAP fill in that gap? And I guess that's when we talk about your mobile clinic. I know there's a mobile clinic that is happening right now. Give us some information about that.
This particular collaboration supports a lot of activities, but the biggest activity of it is the provision of mobile clinics. Now, the mobile clinics are being provided in specific parishes, and that includes St. Mark, St. Patrick, St. John, and Carriacou. And these clinics will be were available in January, and the final round of clinics will be available throughout February. Right. In total, there will be 18 what we're calling integrated and comprehensive sexual reproductive health, as well as gender-based violence and HIV clinics. So there's screening and provision of services in this nice, neat, comprehensive package for clients in these particular communities in these particular parishes. What the comprehensive clinic creates an opportunity is for community members, clients, to have access to the health facilities for extended hours. So between 1 and 6 p.m. on the weekdays that the mobile clinics will be available in these areas, they will be able to meet a team of health professionals that includes a OBGYN, a nurse midwife, an SRH/GBV educator and counselor. The team
Okay, let's go a little bit slow. For the person who are listening and don't know what these acronyms mean, you might want to tell us what it means. Yeah, so let's kind of digress a little.
OBGYN is basically your I can't say that word, it's a tongue twister for me, but your gynecologist.
Oh, your gynecologist, yeah.
Yes.
We'll stick to
right? That. So, yeah, I don't want to put yeah, let me leave it alone, right? Yes, and then the SRH educator, GBV educator, is basically someone who is there to provide information on specific SRH issues, GBV related issues. We have youth volunteers from the Planned Parenthood's youth advocacy movement. These are a group of young people who I must commend them. They're amazing. They're very
amazing. I had an interview with them, and they're so articulate. They are amazing.
I'm just like, what a time to be alive.
I know, right? Yes.
But they're an amazing bunch of young people who are passionate about adolescent reproductive health, and I know that they have played a key and are playing a key role in doing transit walks throughout the communities where the mobile clinics are available, just, giving out information, building awareness, letting persons know about the extended hours, the professionals that they can come and meet there, the services that they can access there. And yes, there's also a member of the Special Victims Unit from the Royal Grenada Police Force. There is someone from the Parenting Program representing the Ministry of Gender Affairs, and even stakeholders from CPA, which is the Child Protection Authority. So quite a integrated and comprehensive team and package has been put together and is being made available at health facilities. I can give you a few dates, but I would encourage everyone to go on the social media pages for GrenCHAP, for GPPA, particularly if you're interested in the mobile clinic dates. You just get on GPPA's page and you can easily access that information. Like, for example, today there was a mobile clinic available in Samaritan. On the 9th of February, they'll be in River Sally. On the 11th, Hermitage. And then on the 15th, 16th, and 17th, they will be in Caracou. Yeah.
Okay, so I guess our final question for today would be: tell us some of the free services that will be provided at those mobile clinics in the different communities. Tell us some of the services. And another question: would there be a counselor at those mobile clinics?
Yes, there is a counselor. That would be the SRH GBV educator / counselor. Okay. That person will be there. Some of the services will include things like pap smear screening, prostate exams for men. There will be testing, of course. There'll also be
tested for all sexually transmitted diseases.
Yes. Okay. You can get the HIV testing screening done there. And for other STI screenings, we particularly encouraging persons to access that at GrenCHAP, because we do provide testing for herpes, syphilis, HIV, and I believe there are 2 other STIs that we screen for as well. Yes.
Tell us some of the sexual, reproductive health services that you'll be provided at the various mobile clinics for the month of February.
Okay, so the services will include access to SRA services. So we're thinking things like pap smear exam, your breast exam, prostate exam, as well as HIV screening. You're also thinking access to contraceptives, so birth control, condoms, IUDs. In the case of women going for pap smears, there's also access to cryotherapy. That's something that I would encourage persons to contact the GPPA to learn more about. It's definitely a service you would want to take advantage of if you are in need of it. At GPPA, at GrenCHAP, we are making accessible STI testing. So we're thinking HIV, syphilis, herpes, testing and screening. Yes. As well as just having access to a counselor who is there to provide information specifically on sexual reproductive health related questions, as well as gender-based violence.
Okay, well, thank you. This sounds like a really inclusive mobile clinic that you're going to be having and provided for persons free. So I take the opportunity to urge you guys to go out there to the various clinics if you want to run the dates again by us. But as Ms. Abraham mentioned, you can check out the Grenada Planned Parenthood website. They have all the details there, and I know that GrenCHAP is also running ads and all the information is there as well. So thank you, Kizzy, for giving us all the information you are giving us today about the barriers to effective healthcare in Grenada, Carriacou, and PT Martinique. Now, this program was brought to you, as I mentioned at the beginning, through a collaboration effort of GrenCHAP, the Grenada Planned Parenthood, the Ministry of Health Grenada, with funding from the Canada Local Fund Initiative. I am your host, Lorna Dale Charles, and we would see you for another session where we're going to be educating the public on various sexual health reproductive issues. Thank you again, Ms. Abraham.
Okay, you're welcome. And the Facebook pages for GPPA, you will find the dates for the mobile clinic. We have mobile clinics going up until the 17th, and that's when there'll be the last day in Carriacou. There will be a mobile clinic on the 21st of February, and that will be specifically a referral clinic for persons needing follow-up. And there will be a second referral clinic in Guelph on the 23rd of February.
All right, good. So there you have it.
To follow up on those dates.
Right. Bye. So there you have it again. Thank you again. You're welcome.